This is a social and cultural theories presentation by Amy Jensen. Let's begin. We will be discussing two social and cultural theories, multicultural counseling theory and agenda setting theory. Each theory is unique. Today, we will examine the ins and outs of multicultural counseling and agenda setting theory. We will describe each of the theories and their importance with today's social and cultural influences. And lastly, we will apply each of these theories to specific real-life scenarios in a counselor-client setting. Multicultural counseling theory, or MCT, requires an understanding of how cultural and identity issues impact an individual's mental health and how those factors might influence a patient's relationship with counseling itself. MCT recognizes that there may be system stressors such as racism, prejudice, and discrimination involved, in addition to someone's personal conflicts. This challenges the traditionally developed psychology we know and hear about. Multicultural counseling theory challenges the biases that traditional methods have developed. Oftentimes, MCT is creating group settings instead of one-on-one to optimize learning from peers. Worldviews, or the way an individual has relationships with nature, institutions, or other people, can apply to groups of people, not just an individual. People with similar or starkly different worldviews can learn from each other. Multicultural counseling theory acknowledges the diversity of people on Earth and understands that, for example, talking isn't the only medium. Some cultures value extended family more than other cultures, and some people believe cooperating and working as a team is more successful than individual success. MCT broadens the view that only an individual is responsible for their life, but recognizes the belief that external factors may also be responsible. There are many influences on mental health. These factors are recognized in multicultural counseling theory as playing an important role in an individual's lived reality and how they approach mental health and counseling. A therapist using MCT will factor in how someone experiences life and how they relate to others. Therapists are not passive participants in multicultural counseling. In order to be effective, there is a must-do list. First, a therapist must be willing to self-reflect on her own biases, lack of awareness, or understanding. This will take recognition, acknowledgement, and possibly personal therapy to move beyond limited thinking. A therapist must appreciate cultural differences and have cultural awareness, acknowledging oppression, stereotypes, racism, and marginalization. A therapist must pursue education in cultural competency and historical context. And lastly, a therapist must develop cultural sensitivity, along with culturally appropriate intervention strategies and a willingness to refer clients to other therapists if necessary for a client's betterment. Multicultural counseling can be beneficial for a therapist. One can expand their therapy skills in regards to teaching, consulting, and advocacy, and build a repertoire of diverse counseling modalities. Her perspective can broaden with group counseling and the exposure to diversity. A therapist can increase her helpfulness for clients and whole systems by using multicultural counseling theory to explore prejudice, discrimination, and racism. Because I am pursuing professional counseling, the benefits for clients that multicultural counseling offers and the opportunity to unlearn, relearn, develop, or change is appealing as a well-rounded approach to therapy. MCT looks at the whole person and the entirety of his environment, past and present. This holistic view can help build quality client-therapist relationships that allow for the possibility of challenging the systemic issues many face today and bring hope to a bright future. Agenda setting theory is a phenomenon of the mass media selecting certain issues and portraying them frequently and prominently, which leads people to perceive those issues as more important than others. An article by Maxwell McComb states that news media is a major influence on the focus of public attention. To be clear, agenda setting is not telling the public what to think, but rather what the public is to think about. The media has a specific role in agenda setting theory. That role is to determine issue importance. Salience can be influenced by what the media believes the public will be more likely to discuss or debate. The media then shows coverage of the issues over a period of time. This is the media agenda and the first level of agenda setting theory. During this time of coverage, a second level of agenda setting theory can begin to shape the public's perception of the issue. Once coverage starts to subside, so does public interest. This is the beginning of a new cycle of media agenda by determining a new issue of salience. In the hierarchy of effects, the public will first learn of the importance of an issue that started with the media agenda and then transfers its salience to the public agenda. Once an issue has been introduced to the public begins to form its opinions on the matter, but only what it's been shown. In the Media Effect Theories chapter on agenda setting theory, it explains that our opinions and behaviors are a response to those pictures in our heads, not the larger outside world. These views can cause such a rise of public opinion that as a whole, action is taken. For example, smoking went from a personal concern to a very public concern, resulting in the changing of laws due to the salience determined by the media. At first glance, agenda setting theory seems to be a negative on society, but with deeper research, we learn that agenda setting can be used for the good of the public. Mental health has had a rise in importance and prominence since the coronavirus disease pandemic. Because of the determination of importance by the media, mental health is now being talked about by the public. These discussions are helping the public to form opinions on the topic and may allow people to stray from cultural norms in regards to mental health. Because of media coverage, mental health is being considered in healthcare policy plans and changes. Action is being taken. This is beneficial for clients from all socioeconomical backgrounds to receive affordable care and for counselors to build their practice and their skills. Thank you.